Then you want to get your vials. And we call it a rainbow because you've got all different colors. Bag behind you on the table. Oh, perfect. So you're gonna have like, each hospital's gonna have their system they use. And TMC uses a slightly different color code system than I use at work. But basically, if you're gonna draw labs for like a patient in the ED, you just draw the rainbow. Or if a patient's like having a rapid response or something, things are going bad and the doctor says draw labs, you just draw the rainbow, and that's like everything.
Repeat it.
Yeah. And then they'll put the order in, then the lab can kind of sort out what they need, but at least they have each type of vial. So lavender is usually, it's gonna be your just complete blood count. Yellow is usually chemistry. It's gonna be all your electrolytes. At TMC, their chemistry is a pistachio colored vial. Green is gonna be troponin, like your cardiac enzymes. A couple of lactic acid, and then blue is going to be your coags, your INR, and your PTT. In each hospital, whatever, they buy a big machine that goes in the basement or somewhere that runs all the labs, and whatever system they use, their vials might look a little different or have a different color. So when I was in nursing school, we had an instructor who was kind of sort of new age, and she was talking about using lavender to help patients like fall asleep. And I remember I was like in class thinking like, that they don't do that at the hospital, lavender. They're talking about putting it like on a cotton ball and putting it under their pillow so they'll fall asleep easier. So then the first week we were in clinicals, there was this drawer and it said lavender. And I was like, maybe they do have lavender, but this is lavender. This is gold and this is lavender.
They do that in aromatherapy.
Yeah.
They do.
Do they?
Mm-hmm.
So you get your vials ready. And let's see. And there's usually a thing called butterfly. And it's going to be similar to like a little pigtail that you can hook up for drawing your labs. This is going to be the part that the vial sticks into. And not all of these are compatible. Let's see. So this is one way to do it. The other way is the butterfly, and it's gonna have the needle that's gonna be attached to a little piece of tubing. And then this will sit here and your needle will be over here. We might have one of those laying around. So basically, it's gonna be similar to putting your IV in, but you don't have to worry about where the catheter is laying. You can get blood out of a knuckle, you can get anywhere you see a vein pop up, even if it's just a teeny bit. All you have to do is get that tip of that needle into that vein. You don't have to worry about like where you're gonna feed a catheter. So you can access a lot of different stuff, like smaller veins that you couldn't access with when you're placing the IV. So same thing, you want to put your tourniquet on above, clean off your site, have everything set up close by, because once you're in there, you're going to have limited hand usage and you want everything within reach. Or when you're first starting to do this, like I'll be with you, the nurse will be with you, but sometimes it's nice to have like somebody else with you if the patient can't hold still or if you need help pushing your vials. So same thing applies. You get your tube. These are all vacuum sealed and they will suck in the amount of blood you need. But you don't want to push it in. Like if I push this in right now, it would lose the vacuum. So you just kind of set it in there. Beveled down, and the same thing goes for the IV. You want your point going right into the skin.
Bevel up, don't you?
Yeah, I mean bevel up.
Okay.
Point down, bevel up. Sorry. Thank you.
I was like, crap, I gotta do some habits.
You go straight in. And then you push your tube and it'll fill up what it needs to. And usually for these, most vials, you just need to get it to the bottom of the sticker. And you will learn which ones need to be filled up more than others. The blue top always needs to be completely full, whatever the coag is. If you don't fill it up all the way, then they just toss it and you have to draw another one. So from here, you fill up whatever vials you need.
When they say draw the rainbow, then since you need the blue one full, should you start with that one then, just in case there's a problem with the draw?
Actually,
collapses or something.
That's a good question. So then here, you just pop that and it'll lock the needle, and it's the same thing as the IV. When you pop the tourniquet, the first couple times you do this, you're gonna be so excited you're gonna forget to pop the tourniquet. Everybody does. And then at some point you'll create a little memory trick to remember to pop the tourniquet. As far as filling up the blue top, if you're using a device like this that's really close, that there's not a lot of wasted space, you can usually start with your blue top. If you're using the pigtail or the butterfly, and it's basically going to be a piece of tubing on here, you have wasted space here. So if you start with your blue top, it's going to be empty because it'll suck in some of that air. So sometimes the lab will have like a order they want you to draw them in, but what I found is you never want to draw your blue one first, and you never want to save it for last, because sometimes you'll access a vein and it'll start to kind of clot up or it won't draw good. You figure out which ones are most important and draw those first. But you want to make sure you don't suck air into this one first. Sometimes I'll draw two of these and I'll save one. That way if lab kicks one back, or I'll send both of them down. That way they have enough one way or the other.